Good evening and welcome to our COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. UK returnee stranded again at the Murtala Mohammed Airport. Minister of Foreign Affairs admits government got it wrong. Lagos government raises hope that state may not reach the projected figure of 90,000 to 120,000 confirmed cases of COVID-19. Kaduna governor personally monitors COVID-19 compliance, physically climbs a truck to inspect the contents. And coronavirus stoking hostility around the world. Since the lockdown over the COVID-19 pandemic, a lot of Nigerians have been caught up in the decision taken by countries all over the world to keep the virus at bay. Many of them have been eager to return to their home country, compelling the government to take a decision. Earlier in the week, some Nigerians arrived from the UAE, and today we have more coming in from the United Kingdom, and yet more people await in India and the United States. A Nigerian who went to seek medical attention in India has not been able to come back into the country weeks after successful treatment. We'll be talking to Vese Esther on the situation. On our theme, we're also looking at stranded Nigerians returning back to the country. The Nigeria Center for Disease Control, NCDC, has confirmed in total number of infections in the country standing at 3,526. The NCDC also announced that 601 patients have been discharged, a total of 107 deaths recorded. In one day, the nation witnessed 381 new cases across 18 states, with Lagos, Kano, Jigawa the top three highest. Lagos remains the epicenter of the pandemic with a total of 1,491 cases, followed by Kano in the northwest with 482 cases. The FCT did not record any new case yesterday, but has the highest infections in the north central, while Borno has the highest figure in the northeast with 125 cases. Edo still leads in the south-south with 65 cases, Enugu in the southeast with 9 cases, even though both states did not record new cases as of yesterday. Some Nigerians who are stranded in the United Kingdom following the COVID-19 lockdown are back in the country. The 253 returnees arrived at Murtala Mohammed International Airport, Lagos, earlier this afternoon and will be airlifted to Abuja, where they will be quarantined for 14 days before being allowed to leave for their destinations. The Nigerian High Commission in London had announced the plans to evacuate about 700 stranded Nigerians in batches, listing procedures to be followed. Their arrival is coming 2 days after 265 citizens were evacuated from the United Arab Emirates by the federal government. In the meantime, reports reaching us from the Murtala Mohammed International Airport, Lagos, says that the voluntary returnees from the United Kingdom are still at the tarmac 4 hours after their arrival. The original plan is that upon arrival, they're meant to join a connecting flight to Abuja, where they're meant to be isolated for 2 weeks, but that is yet to happen. They say they are yet to hear from the Ministry of Foreign Affairs or NEMA regarding their flight to Abuja. They arrived Lagos at 1:30 p.m. However, the Minister of Foreign Affairs, during the briefing, the Presidential Task Force briefing this evening, tendered an unreserved apology to the evacuees, admitting that they got it wrong in the evacuation. Mr. Geoffrey Onyema admits that they didn't get it right. The passengers have had to wait unreasonably long time. He says government regrets the inconveniences caused them collectively and also individually. We now join Vese Esther, a Nigerian stranded in Bangalore, India, via Skype on her situation. Thank you, Esther, for joining us at this time. Tell us, how long have you been waiting without being able to come back home?
Oh, well, we're supposed to leave initially on the 12th of April, but our flight was delayed, moved back 4 times already. So we've been here for almost 2 months, really just waiting. We got here in March, so we've been delayed for about 2 months so far. And if we're supposed to go without the government, that means we'll be waiting till July, and there's still no certainty as to whether or not they would still delay that flight, move that flight back.
Did you contact the government? Is it the government that's planning to airlift you and perhaps others from India?
No, the government actually, the High Commissioner of Nigeria here in India, New Delhi, has reached out to quite a number of Nigerians, created a WhatsApp group. We're over 200 Nigerians, is it now? And he's trying to make arrangements for us to get a flight that will take us from one of two ports in India, that's either New Delhi or Bangalore here back to Nigeria as soon as possible. But of course, there are certain limitations that, or restrictions rather, that he's trying to handle at this point in time.
How have you managed thus far? And do you think that there are many Nigerians like you in Bangalore, India, that are waiting to come back home?
There are a lot of us. Yeah, a lot of us, students stranded, people here for medical reasons, like myself, and then for business, a lot of people stranded. I mean, it's becoming something else really, because when you think of paying for the accommodation, the feeding, the hospital bills, and everything, it's quite something. And then there are people who unfortunately have lost their loved ones and are considering or worried about how they're going to get their loved ones back home, the bodies of their loved ones back home. But the possibility of that being taken into consideration right now, considering the urgencies, is really slim and really disheartening, really. I mean, it's not really very easy for Nigerians right now.
All right, we definitely hope that the government authorities are listening and they can quickly bring you safely back. We'd like to thank you, Vesey Esther. Thank you for joining us at this time.
Thank you.
Continue to stay safe.
Thank you very much.
All right, let's come back to Lagos, where Dr. Ola Brown from the Flying Doctors Healthcare Company joins us. Welcome.
Hi, nice to speak to you today.
All right, same here. Literally flying doctors, and we're having a lot of Nigerians who want to come back home. What's your take on perhaps some of the evacuation considerations you've been noticing?
Okay, I have to sort of draw a line between medical evacuation and the type of evacuations that we're talking about here. One of the things that our company does, we are an end-to-end healthcare company, but one of the things we do is medical evacuations for people that are very sick. These are more diplomatic evacuations. And listening to the lady that you just spoke to, stuck in Bangalore, and speaking to some of the people that are stuck in other countries, it's a really unfortunate situation, but it's a situation that affects everybody in the world right now. And I think the government has tried to make provisions for evacuation, but as you know, poverty makes everything difficult. Being from a poorer country makes everything difficult. So you can see the developed countries immediately, they mobilize the plane, they don't really care about the cost, they just move all their citizens back, and they have all the money to cater for them properly. But in Nigeria, our oil price has gone down, we have fiscal constraints, we're struggling with a lot of our budgetary issues right now. Our budget was slashed by almost 50%. So it's a lot more difficult in terms of coordinating these evacuations and all the other things that we have to do to make sure that we get on top of this epidemic. And it's an epidemic or a pandemic more that even developed countries are struggling with. They're struggling with coordinating evacuations. They're struggling with treating patients. They're struggling with quarantining patients. And they're having to make very, very agile decisions about what to do with their airports, etc. And Nigeria is faced with those same decisions, only 1% of the money.
Very interesting. But looking at what they will be facing, we have several of them that are here already.
Absolutely.
They have to go through certain processes, and this is a pandemic. What do you think, what kind of protocol should we expect? And this is also to prevent the spread of COVID-19.
So I think the government officials are in the best place to sort of put together those protocols and guidelines. And I don't speak for government in any way. I'm a sort of private citizen and a physician. But I think that that we know that self-isolation didn't work as well as we thought it was going to work. So you remember the initial thing, all the people that came back from London, just stay at home. We trust you people won't go out, and you guys monitor yourselves for two weeks, and then, you can come out. well, the people that came back from London and Germany and all those countries, they didn't quite do that. And this is, a lot of them did. A lot of them did stay at home for 2 weeks, and I think the large majority of them were compliant. But the small minority that were not compliant caused a very big problem from Nigeria, because all of the cases that we have, that has now gone to almost 4,000 cases, started from those people that had traveled abroad and came back. And, you know, instead of self-isolating for 2 weeks, went to parties and, you know, went to five different states and were coughing on top of everybody.
But tell us about testing. There's several mobile testing that's coming up. There's rapid response. There's the drive-through. What's your take with regards to how we're expanding our capacity?
I think we've been expanding our capacity quite well. And I think we've moved from, I think there were barely any labs to labs in several states. So we've ramped up that number of molecular labs quite quickly. The decision that Nigeria has taken is to only do the PCR test, the polymerase chain reaction test, which is different from all these 5-minute, 10-minute tests that you see in other countries. And the reason why Nigeria has taken that stance is because PCR is a gold standard for testing. And I mean, people have been very critical of this decision, but I think that the decision that the authorities have taken is a decision that is, you know, in line with what a lot of countries have taken, which is to only use the gold standard test to avoid too many false positives and false negatives, because of course that causes confusion. If you are positive, if you are actually positive and the test says that you're negative, then you go out and start talking to your family members and go and spread it. And if you're negative, and the test tells you that you're positive, then they put you in an isolation center with positive people and you become positive automatically. Ouch. So that's the reason why, in terms of mobile testing and the booths that we've developed, they're not actually for testing, they're for the sample taking. So sample taking is a big bottleneck when it comes to getting tests done efficiently. Some of the labs aren't backed up, they're just not getting enough samples. So what we've done is provide a safer environment, a more sort of box which separates the patient from the tester. So it protects the patient because there's a glass wall between the tester and the patient. And it also saves on PPE, because when you're testing, when you go to people's houses and test, then you have to change your PPE every single time that you go to the patient's house. Whereas if you're in a glass box, then you wear one PPE and you can test through external gloves and you don't come in contact with the patient. So the advantage of the mobile testing vehicle and the booth is, number one, it saves cost on PPE, and you know there's a global scarcity of PPE. I don't know if you've seen the German doctors protesting. They're doing all these protests in the hospital that even they can't find PPE. And then the second big advantage is we can't have the same level of healthcare worker infections that they had in Europe. You see these ridiculous statistics of 6-7% of healthcare workers getting infected with COVID. If 10% of our healthcare workers get infected in Nigeria, then that's practically all of our doctors gone. So we can't afford that. So the testing booths and testing vehicles protect healthcare workers and save costs on PPE. And those are two things that we really, really need to do right now.
All right. We appreciate your time. Dr. Ola Brown from the Flying Doctors Healthcare Company. Thank you for joining us.
Thank you, Millicent.
The Lagos State government is making an expert projection of between 90,000 to 120,000 cases of COVID-19 in Lagos State by July. The State Commissioner for Health, Professor Akin Abayomi, disclosed this during a press briefing today, where he explained that the state will likely also commence hydroxychloroquine trials in about a week, and that the state is currently manufacturing sample collection kits and working to get more test reagents.
Well, there's a difference between what the model says in terms of how many people are going to be infected and what our capacity to identify positive people is. So our model suggests that by July, we're going to see somewhere between 90 to 120,000 positive cases. However, our testing algorithm only tests for people who have developed symptoms. I said earlier that many people will catch COVID-19 and may not even know that they have it, which is why it is a virus that can spread so easily in community. If you don't know that you have it, you're not likely to present yourself for testing, and in fact, there may not be a need for you to be tested, as long as you're practicing what we describe as social distancing, respiratory etiquette, and good personal hygiene.
Let's now bring you some of the efforts of state governments across the country on steps to stopping the spread of COVID-19. The governor of Kaduna State, Nasser El-Rufai, seen monitoring compliance of lockdown at a boundary between Kaduna and Kano State. He physically climbed the trailer for a thorough screening of its contents. We understand that during the monitoring, he also turned back trucks and other vehicles coming to Kaduna from Kano. Only petrol tankers and vehicles carrying food items were allowed to pass. This enforcement is coming following reports of some unauthorized vehicles still coming into Kaduna State from Kano and other parts of the north using illegal routes. It was the first outing of the governor since he was discharged from isolation center after testing positive to COVID-19. The Enugu State government has launched the distribution of 1 million free face masks across 17 local government areas of the state. At the Michael Okpara Square today, local government chairmen, security agency leaders of the Hausa community, the state's deputy governor, Cecilia Zilo, said the move is aimed at protecting lives of citizens, boosting the local economy. Another distribution is happening in Oyo State, where the governor, Seyi Makinde, kick-started the donation of relief items to 90,000 poor households to cushion the economic effect of the pandemic. The distribution of palliatives was among the people of Igbora, Ibarakba, North local government area. The governor also inspected some of the hospitals that have been designated to serve as isolation centers for outside the state capital, those outside the state capital, that is. And resident doctors working at the Ondo State University of Medical Sciences Teaching Hospital, they're giving government 1 week to pay up their salary arrears. The doctors, numbering about 100, have threatened to resume an indefinite strike if they are not paid. And according to the Nigerian Union of Pensioners, its members have been neglected and they need protection from the ravaging effect of COVID-19. At a news conference in Abuja, the General Secretary of the Union appeals to the Presidential Task Force on COVID-19 to channel any palliative intended for pensioners through the leadership of the Union. The pensioners say at least 5 of their members have died from the virus in Kano State. And the wife of the Edo State Governor, Mrs. Betsy Obaseki, has allayed fears over increasing numbers of positive cases of COVID-19 in the state. She says it should be expected as the state government increases testing capacity. Mrs. Obaseki made the assertion while distributing a 5th tranche of relief materials to the vulnerable, including face masks, hand-washing buckets, food items at the government house in Benin City, the state capital. Now, Dr. Osinachi Ubani is a public health physician, and she joins us for more on ways we can tackle the pandemic. Welcome to the program.
Thank you.
What do you make of Lagos State projections on the number of COVID-19 cases hitting almost 120,000 by July?
It sounds like a large figure now, but remember we are having full-blown community transmission, meaning that now we're going to have people who we can't trace exactly how they got it. And looking at the population of Lagos, over 20 million, 120,000 by July is actually a very safe projection. It may actually exceed that.
Interesting. Now, some people are saying we're easing lockdown and we're having this projection. Should we go back to locking down, especially Lagos State, with what we're seeing with projections such as this?
Well, we locked down when we had less than 100 cases, and then we're easing off lockdown with almost over 1,000 cases. It's not something I can say categorically, this is better. Remember, we're trying to weigh, I said before, we're between the devil and the deep blue sea. It may be something that will be beneficial eventually to lock down again, because looking at what happened when the lockdown was eased off, at least we all saw what happened in some banks, in some public places. There was no way anybody could have achieved social distancing because everybody wanted to achieve everything they hadn't done in the past 4 weeks of the lockdown. So it may be imminent, but that would be a tough decision that government has to take.
But if you were to advise government, would you recommend that we should?
Definitely to help. At least it would reduce the number of people that would come in contact with each other. It would reduce community transmission. It would also give the health workers, the frontline, health workers, the time to do a lot of more contact tracing. People would be in one place. And the frequent movement from place to place is one of the things that is moving the virus.
All right, we'd like to thank you, Dr. Osinachi Ubani, a public health physician. Thank you for joining us.
Thank you.
Always a pleasure. Earlier, we reported that UN Secretary General Antonio Guterres had called for an all-out effort to end hate speech globally. He said the coronavirus pandemic had unleashed a tsunami of hate and xenophobia. Well, Mr. Guterres did not give any specific examples, but let's tell you about some of the incidents that have been reported. India has seen a rise in Islamophobia after an event linked to a Muslim missionary movement, the Tablighi Jamaat, spawning clusters of COVID-19 cases across the country. Jonathan Mock, a student from Singapore, said he was beaten up by a group of men in the UK who told him, "I don't want your coronavirus in my country." And the head of the World Health Organization has said he had been subjected to racist attacks from Taiwan, which its president denied. Africans in the Chinese city of Guangzhou complained of discrimination, saying they had been forced from their accommodation and treated unfairly by authorities. And China accused the US President Donald Trump of stigmatizing the country after he referred to COVID-19 as the Wuhan virus. A report by researchers in Israel said the coronavirus crisis was stoking anti-Semitism around the world. From the Nigeria Center for Disease Control, you can access a revised guideline for businesses to operate smoothly this period. The center continues to work closely with states. You can find the latest national strategy to scale up access to coronavirus disease testing in Nigeria and other public health advisory. Also, the World Health Organization's website is live each moment, regular updates about the spread of the pandemic. You can take a closer look at the numbers in real time. And that's our COVID-19 update at this time. Thank you for watching. I'm Millicent Walker.